Hello doctors, welcome back to our channel. Today we are going to see about cardiac murmur. Okay, let's get jump to it. What is cardiac murmur? It means abnormal sound produced due to turbulent flow within the heart. This can be heard during cardiovascular examination. Well, we said turbulent flow. What causes the turbulent flow? In case of high flow velocity or small orifice or low kinetic velocity, these are the main causes which lead to turbulent flow. So we hear murmur. Okay, what to check? We will check the length, intensity, shape, pitch and location of the murmur. Generally, there are three types of murmur. The first is systolic murmur. These murmur are heard in systolic phase in between S1 and S2. And the second is diastolic murmur. These murmurs are heard in diastolic phase, which means in between S2 and S1. And the last is continuous murmur. This has two characteristics. First is murmur should be present in systolic and diastolic phase. And the second is peak of the murmur should be on S2. In this video, we will focus on diastolic murmur. In next video, we will see on systolic and continuous murmur. Let's move to pathology. First of all, we will see mitral stenosis. Normally, the mitral valve has 4 to 6 square centimeters. But in case of severe mitral stenosis, it became less than 1.5 square centimeters. So it became much narrow. We will see simultaneously normal and stenosis valve blood flow to understand what's happening here. In normal, blood will easily pass through the valve in linear blood flow. But in case of mitral stenosis, the orifice become narrower due to high force in the atrium. The blood try to pass in narrow orifice, which lead to turbulent blood flow. In this moment, we hear murmur. During severe mitral stenosis, we could hear mid-systolic murmur, which starts from opening snap and at the end presence of presystolic accentuation. Okay, I have a question for you guys. The first is, why presystolic accentuation occurs? Second, is it possible absent of presystolic accentuation? If you know the answer, comment below. If you want to know, follow this video. Don't skip because these questions were asked in exams. Okay, let's see the first question. Presystolic accentuation happens due to atrial systole. During atrial systole, atrium starts to contract, which causes the more force. This leads to small second strike in murmur. Okay, from itself, you may get the answer for the second question. Presystolic accentuation happens due to the force in the atrium. In case of atrial fibrillation, there will be a problem with atrium contraction. So this leads to absence of presystolic accentuation. Can we check severity of mitral stenosis by the murmur? Yes, we can. But it is not dependent on loudness of the S1, loudness of P2 or the intensity of the murmur. It's only depend on the length of the murmur. I will explain. Okay, let's assume this patient has a mitral stenosis. So we see the murmur. In case the disease become more severe, pressure in the atrium is higher, so the opening of the mitral valve become earlier. This lead to lengthening of the murmur. Okay, let's see the treatment of severe mitral stenosis. The treatment is percutaneous mitral balloon valvotomy. In this procedure, we will puncture the basilic vein with the presence of fluoroscopy. We move through subclavian vein to right atrium. Then we puncture the interatrial septum and move to the left atrium. We insert a balloon in between left atrium and left ventricle and inflate the balloon. This will lead to increase the orifice of birth. Mainly, percutaneous mitral balloon valvotomy is contraindicated in calcified severe mitral stenosis because it causes embolism, in severe mitral stenosis with mitral regurgitation, and in severe mitral stenosis with left atrial appendage thrombus. Okay, let's move to aortic regurgitation. Especially in severe aortic regurgitation, I mean if the backflow of the blood is nearly 50%. So, we will see in this picture. During severe aortic regurgitation, the blood leaks back to the ventricle due to aortic valve defect, which causes a turbulent flow in the ventricle. In this, we will hear the mid-systolic murmur. It starts from S2 and it won't start from the opening sum because mitral will have nothing to do with it. And in generally, this murmur is called AUSTIN FLINT murmur. By the way, please do watch the heart sound lecture for better understanding. It's on the description box. We have seen severe aortic regurgitation. Let's see mild aortic regurgitation. We said mild, so it is obviously less backflow of the blood, which refers small murmur. From our previous video, you know about the time lag between each valve closure. During mild aortic regurgitation, we will hear early diastolic murmur. In case of mild pulmonary regurgitation, we will hear the same early diastolic murmur, but it starts from P2. I will show in this picture. If the mild pulmonary regurgitation is caused by pulmonary hypertension, it is called as Graham Steele murmur. Okay, let's move to atrial septal defect. In atrial septal defect, there will be presence of shunt between the atrium, but the pressure gradient between the left atrium and the right atrium is 4 mm per mercury. Due to small difference between the pressure gradient, the shunt murmur is absent. So in this case, increased blood in the right atrium, which causes more blood flow to the right ventricle. This lead to flow murmur. In flow murmur, we could see mid-diastolic murmur. Thank you for watching. Hope you see on the next video.